is number two is that CE is necessary. I look at this as kind of you're going to give us a little bit of a big picture vision, but why does the executive director of CSTEAMS, it's not your job saying this, it's not job security. You're doing this because you believe it. Why is CE necessary?
CE is necessary because EMS is the most rapidly evolving profession in the world. It changes and morphs daily. Practice standards change, equipment changes, our abilities to perform certain tasks in the field change, our abilities to analyze and assess and diagnose people change. For example, the advent of ultrasound as an EMS skill is something that where the technology has driven the profession to a certain point. And in order for us to keep up with the changes, we really need to do continuing education. It's just necessary, and it's part of the job, and it's part of the realm that we happen to work in.
If you this, and I told you I was going to throw a couple of questions at you as we go here. What would the director of CAPCE doing CE to maintain your license? What's your favorite topic? If you could list look, there's a whole big list of Con Ed things on your screen and your provider. What would you love to listen to or watch?
I just did my favorite lecture last night for a paramedic original program, and I did an acid-base balance lecture. And a lot of people think I'm crazy that how could you enjoy acid-base balance? But it honestly is my favorite topic. But if you present anything in a case-based format, for example, if you happen to have access to a simulation lab or a virtual patient or a compilation of video-based cases where you can group things together like simple, non-complicated chest pain, and the second case is a little more severe with a STEMI, and then the third case is a full-blown cardiogenic shock, and clumping those things together and starting with, here's what we're going to tell you, here's the signs and symptoms you're going to look for, and then you do a case either in a simulated environment or in a video-based environment, and then you move it up. All right, so the next case is this, and these are the treatment things we're going to add to that patient, and the next one is even more severe, and here are the things that patient needs. So clumping cases together in a group that makes sense, that provides for a non-stressful learning environment, I think those are my favorite things. My favorite topic is acid base. My favorite environment is being able to do case-based learning around a series of patient scenarios.
I'm not worthy because an acid-base thing is my least favorite. So I am very impressed just with that. It took me by surprise, as probably most people listening to this. I was recently at a presentation the National Registry did an educator conference. And one of the things that they say that they're looking to test more as they work towards phasing out psychomotor exams is judgment and thinking. And I think that continues into what you're saying is that when you can learn to apply and have some challenging cases and things that aren't the basics, that I think we benefit from that and we grow, that CE can really help us grow.